At some point in a first responder's career, they are likely to encounter a person with some type of disability who will need assistance. This training video is meant to add to your personal and professional toolkit so you will know how to help someone who has a disability. Parts of this video are told from the perspective of people living with disabilities who have had both good and bad experiences when they've called for help. Just as every emergency situation is different, every person, with or without a disability, is unique. This video stresses the importance of considering the person first, not their disability.
An acronym.
To help reinforce the tips you're about to learn, remember ALIVE, which stands for Ask, Listen, Integrate, Vary, and Engage. When on the scene, ask the person how you can best assist them. Listen to their response, integrate the information received into the response, vary the response accordingly, and engage the person for a positive outcome.
The letter A appears. A heavy-set bearded man speaks. Paul.
I was sitting on the edge of my bed, about to transfer into my wheelchair, but without warning, I blacked out. I completely lost consciousness and fell off the bed, face first to the floor. I was unable to move. I was jammed between the bed and the wall. My forehead hit the corner of my wheelchair battery charger, which is a steel box, and my left leg was bent underneath my body. I couldn't move. My wife called 911, and the first responders arrived within 2 to 3 minutes. The first responders asked if I was having trouble breathing. I was, so they put me on oxygen. Once I explained I was disabled, they wanted to know the best way to help me. They were having a very difficult time because of where I had landed. They had to flip my bed over to get to me, and once they did, I was able to instruct them on the best way to move me and how to roll me over and how to secure my legs. They listened and gently, carefully did as I asked them. They got me in a sling and carried me out of the bedroom. The first responders who helped me were calm and respectful. They did a great job because they asked me the right questions and followed my instructions on how best to handle me.
The letter A in ALIVE. Ask. A woman in a wheelchair holds her hand on her chest.
Always ask the person how you can best assist them. Ask if they have any physical limitations that may impact the situation. Follow their instructions. If they are a wheelchair user, ask how best to transfer them to their wheelchair and then follow their instructions. And keep the wheelchair with the person. If they use a power chair, turn the power off. A power chair can weigh hundreds of pounds, so it may not be able to go along if the person has to be transported. Bring a manual chair if they have one that folds up.
The letter L. A woman signs for an off-screen interpreter. Sherry.
My husband was doing some remodeling work, and suddenly he fell to the floor clutching his chest. I knew I needed to get help. I'm deaf and so is my husband, so I called 911 on our video phone. The paramedics arrived screaming at both of us. Now I can speak a bit, I can read lips, and I can feel their vibrations. And I tried to tell them to slow down and stop shouting, but they didn't listen. The shouting made me so frustrated, and it made our children cry too. The paramedics transported my husband to the hospital. And when we got there were more questions and more shouting. They did not seem to believe that I was deaf. They kept asking questions like, well, how can you tell that we're screaming if you can't hear? So I asked for an interpreter. And that took a couple of hours. By then I was so exhausted and scared. First responders need to understand that many deaf people can read lips a little bit and they can feel sound vibrations. But when someone shouts and screams, it causes us more frustration on top of all the other frustrations and emotions the person is experiencing. Fortunately, my husband did get the treatment he needed, but trying to get him help did not have to be as traumatic as it was.
The letter L in ALIVE. Listen. Paramedics enter a home where a man clutches his chest.
Listen to their response. Here's a better way to respond to a call involving someone who is deaf or hard of hearing. Repeat the questions as necessary and be patient. If a person is deaf or hard of hearing, designate one person to do the talking. Establish eye contact. Talk calmly and slowly. It is especially important to face directly towards the person in need so they can see your nonverbal cues in order to effectively communicate with you. Some deaf people can read lips, although this may be very difficult. It may be necessary to use a pen and paper.
The letter I, another woman signs, Andrea.
During a big snowstorm, my daughter, who was 6, started to vomit. She has diabetes, and I was concerned about her low blood sugar and her possible reaction. I called an urgent care hospital and talked to a nurse. The nurse didn't understand my concern about my daughter's blood sugar number and her insulin level. I was very nervous, and the situation was really intense. Nurse asked me questions, and I answered the best I could with the circumstances. Suddenly, an ambulance arrived at my house. I didn't ask for that, and I was mystified. A nurse told me that he had called for the ambulance. 3 paramedics came to my house, and my daughter did all the talking with them. I put down my concerns on paper, and I said that she was vomiting and she's diabetic. But paramedics were focused on her, not on me. I was very confused. I have no idea what they said to me. A nurse should have communicated with me and let me know what he was doing. I would have liked to have known that an ambulance was coming soon to bring my daughter to the hospital.
The letter I in alive, integrate. A woman signs to a paramedic near a man laying on the ground.
Integrate the information into the response. No matter who is asking for help, make sure you tell them what actions you are taking so they are not surprised. Just because someone has a disability does not mean they should be left out of the conversation. Emergency personnel need to understand that for many deaf people, English is not their first language. So you need to be extra patient and communicate using simple, clear ideas.
The letter V, a man speaks, Ken.
I just finished loading the laundry. I was about to head upstairs when I heard a loud explosion and a rush of water spraying against the closed door. By the sound of the water flowing and the vibrations on the door, I knew the water was full blast. As I slowly opened the door a crack, I was hit with a rush of very hot water and hot steam. I slammed the door quickly and started to freak out. I knew that if I went in to try to turn off the water, I would get burned by scalding hot water. Once I got upstairs, I called 911 and I told the operator I was blind and home alone. I explained what I had heard and that I needed help. At first, the operator said they do not usually send help when the call should be to a plumber. But because of the circumstances, a 911 supervisor obtained permission to dispatch the fire department. The firefighters who came to my house found the main water shutoff and the exploded water hose. They showed me where the water main was and how to turn off the water in an emergency. I hope this story will show that a call for help may not always fit into a simple category. Although this was not a medical call, I needed help right away, or it could have become a medical emergency.
The letter V in alive, very. Ken lies on a bed as paramedics enter the room.
Vary the response accordingly. Survey the situation and make changes as necessary, but inform the person of what you are doing. When helping a person who has a reduced level of vision or is blind, identify yourself. Offer assistance, but let the person explain what help is needed. Do not grab or attempt to guide them without first asking them. Let the person grasp your arm or shoulder lightly for guidance. Be sure to mention stairs, doorways, narrow passages, and ramps. If the person has a service animal, do not treat it like a pet. Service animals must be evacuated with the person.
The letter E, a woman speaks, Linda.
My adult son, Tony, has schizoaffective disorder, which is a combination of symptoms of schizophrenia, bipolar, and depression. Tony had just been discharged from a crisis house and was still symptomatic. I had to leave my house for a short time and told Tony to stay put. He was not familiar with the city and had only lived here a few months and had come from a rural setting. When I got home, Tony was gone and so was my bike. I contacted 311 and reported Tony as a vulnerable missing adult. I was very concerned. Hours later in the wee morning, Tony was back home and he was yelling, "Mom, Mom, there's an officer outside and you're really gonna like him. Come on, Mom, you gotta meet him." I hugged my son and then opened the door, and sure enough, there was an officer. He told me that he was patrolling and saw Tony hanging out with a group of very dangerous people. The officer said he recognized everyone in the group except Tony. So he watched and followed him for a bit until he had a chance to motion him over. Once the officer talked to Tony, he recognized that Tony was in a manic phase. The officer offered to put the bike in the trunk and drive Tony home. When Tony gets manic, everyone is his friend. The officer told me that this could have had a much worse outcome. Tony could have been beaten by the boys or worse. The officer had received crisis intervention training, so he knew how to respond. I'm truly grateful that the officer knew the area he was patrolling well enough to recognize that my son was out of place. I can only imagine the grave outcome if not for this officer intervening.
The letter E in Alive, engage. A policeman observes a man pacing on a busy street corner.
Engage the person for a successful response. Some people have disabilities that may be obvious to detect, while others can be difficult or impossible to notice. That can include cognitive disabilities, mental illness, or multiple chemical sensitivities. When dealing with people who have these types of disabilities, speak calmly and allow extra time for a response. Use short sentences, simple words, and sometimes pictures or objects to help illustrate your point. Reassure the person you are there to help.
The acronym ALIVE appears, then Captain Cassidy Anderson, Minneapolis Fire Department.
ALIVE. Ask, listen, integrate, vary, engage is an easy way for you to remember better ways to respond to calls for help from those with disabilities. Ask the person how you can best assist them. Listen to their response. Integrate the information received into the response. Vary the response accordingly, and engage the person for a positive outcome. ALIVE is an additional tool, but it does not replace a first responder's standard operating procedures. Remember, the best way during an emergency to assist a person with a disability is to always consider the person first. Put people first, not their disability.
Credits appear. Thanks to all who made this project possible: Dorothy Balin, Linda Canova, Sherry Ann Carlson, Paul C. Emerson, Phyllis Janess Stein, Martha M. Haig, Marco Imdike Cross, and Andrea Riff. A list of City of Minneapolis personnel appears. Produced by the City of Minneapolis in partnership with the Minneapolis Advisory Committee on People with Disabilities. Funding provided by a federal grant through the Minneapolis-St. Paul Metropolitan Response System.